So now, let me just show you a little bit of over here. He's got a lot of junk coming out of his veins, and you know, we're going along. So we're going to see what it looks like now in the middle of this procedure. Something interesting I just want to show you. Look at, we know the gentleman's pulse is low because he's got a weak heart, so it's, you know, it's pumping real slow. But I just want to show you the, if you look at the percentage of SpO2, SpO2 means percentage of oxygen in the blood. So during treatment, before treatment it was 97, I believe, but during treatment, look at that, 99, 100%, pretty cool, huh? I'll show you this again. Look at the difference in the blood here. This is what they want to see. The dark stuff's out, of course, and the light red stuff's in. Pretty cool. Okay, here we go. Look at this. His pulse rate is now 51, whereas before it was 45. You can see the difference, and his SpO2, his oxygen level in his blood, is at 100%. This is this video I'm making just to show everybody and to show all those detractors that we have that ozone therapy does work. And for all you guys out there that are using ozone therapy, it's a good video for you to prove to everybody that things do work in ozone, so we can stop all this stuff coming from other people saying it doesn't work, it doesn't work, it doesn't work. Okay? You see this gentleman, he's 71 years old. He's had a heart bypass. If he can withstand all this and come out shining, look at this, 53, his pulse is going up, look at that. And still at 100%. If he can do all this, if this can happen to him, anybody can go on this therapy. And what Ein's going to do after this, after I close off, is she's going to tell me, she's going to explain to us exactly what the differences are in the gentleman's heart, and then Pushpa is going to tell us some interesting stuff about it. We're here with Pushpa and Mr. Pushpa, yeah. And we're just talking about what there were some things that he forgot to say about his dad, so I wanted to have him clarify. One of them was that his dad was had open heart surgery, or I believe heart bypass, did he?
Yes.
Was it heart? Okay. Yes. Was it open heart, right?
Yes.
So they opened his chest and all that stuff?
Yes.
All that good stuff. And after they did that, the gentleman's EF, which is ejection fraction, was how much, Mr. Pushpa?
It's around 30.
30, okay.
Yes.
And his, how was he feeling at that time?
Okay, he was looked very tired, and he couldn't walk very fast. Even the doctor advised him not to do a very heavy work, and even cannot ride his bicycle. Okay,
so he was really like, I mean, so all they did really was they stopped him from dying.
Yes, yes.
Yeah, but they didn't really make him any better.
Actually he's looked tired than before.
Oh, he looked more tired when he had the surgery than he did.
Yes.
Okay, but at least they stopped him, and you know, we got to thank them for some things. At least they stopped him from dying and they got him on time.
Yeah.
But Ian's going to tell us, first of all, you said his ejection fraction was 31 or 30. Let's, Ian, tell us what ejection fraction is.
Ejection fraction is the percentage of your blood that your heart is pumped and then go through all over your body.
Okay, so ejection fraction is the amount of blood percentage that goes, that the heart pumps out, and it goes all throughout your body. So ejection fraction is very severe, and it's what is it? And it's what they say is that you can't raise ejection fraction by any way whatsoever.
To me, it's a surprise that the scientist Mr. Peter, and the chairman Mr. Maga, and the MD Dr. Rajesh Kumar, everybody has explained to me the therapy what they are going to be utilized here in this hospital. And I had, by the time I had some severe spondylitis and severe cardiac pain also. I just want to test myself and getting apheresis in this hospital. To my surprise, it is very excellent. And the next day itself, I found I don't have any pain in my chest pain. My spondylitis has gone.
All right. So yesterday we were Prisco was behind the camera, now I'm behind the camera, and today we're looking at a RHP being done. And as you can see, this is a common problem that we have when people first come to us, is we have to clean their blood, and you see that the flow is not very good because there's a lot of fat buildup and a lot of debris inside the blood that can't be taken care of by any other method or process but ours. So that's the first order of business. So when people call us and they say, well, how much is it going to be? How long is it going to take? Well, the first thing we got to do is we got to take out all those McDonald's burgers and French fries that you've eaten out of your blood, and then we can continue and do that. So this is a common problem, right, Prisco?
Yes, it is.
And most people when they come in, this is the problem that they usually have, right?
Yes.
You see all kinds of debris coming out. You see all kinds of fat.
Fats. Yeah.
Yeah, and sometimes they plug up the tubes and we can't get anything out, right?
Yeah, it is. True. So what we can see here now is the cholesterol and fat coming out from the body.
And how long does that go on for? Sometimes duration of an hour and a half, right? They have to sit and.
Today we're going 1 hour and 30 minutes.
Okay, so they're going an hour and a half, so probably they'll have to sit there like they are. You'll see. I can't show the patient, but you'll see like they're sitting there and they're just playing with the tube just to get the tube to go and to for the flow to be okay. I mean, look at this. This is you see it. It's squiggly. It's but it does come out. And we have no issues after that. Once it comes out after 3 or 4 sessions, there's no more of this. Then it's just straight blood, and then we're just cleaning, and it gets lighter and lighter and lighter, and as the person regenerates. This is a Parkinson's patient, and he's been with us now. I think this is the second time doing RHP. You see how the blood is coming back really nice and clean. So it goes and it gets trapped in this filter here. The filter, because of gravity, knocks out all the stuff at the bottom, and there you have it.
One is the intravenous application of the ozone, whereby ozone in a very small amount, 1 ml per minute, is pumped into the patient's blood through the peripheral vein. It goes at the rate of 1 ml per minute. Direct injection, I think they are using with a syringe pushing 10 ml or 20 ml directly. We don't use that. We use a specialized pump that will deliver only 1 ml per minute, which is absolutely safe. And the air embolism doesn't come in one shot for infusing 10 ml or 20 ml. It needs 50 ml of minimum air, 50 to 100 ml, and one shot if it is infused, then it goes and blocks the heart. And that too, we need a nitrous in that particular air. If there is no nitrous and if it is infused very slowly at a rate of 1 ml, no air embolism will occur. That is a major threat in our controversy in using the direct intravenous injection of ozone.
So just if you could say it as simply as possible, he has 4.2 meters and we intend to recirculate that for how long?
So this patient is 60 kg, okay, and his approximate blood volume will be around 70 ml per kg. That will come around 4.2 liters, and we start initially with around 30 to 40 ml till the circulation is complete, and after the circulation is complete we go up to 60 ml per minute. So that will make around 3.6 liters per hour of blood circulating. So it will take for his blood around 1.25 hour for the entire blood of his body to circulate through the filter. So we are circulating it for around 2.5 hours. So twice the blood volume, blood from the vein is taken from the patient, right side tube, and this, the brighter one, is the oxygenated blood, that is ozone mixed blood. You can see the difference. The thing which is taken is darker and the ozonated blood is bright.
Other thing, we were concentrating on the ophthalmic segment, like the patient with night blindness, we call it here in India, it's called retinitis pigmentosa, and the patient with the optic atrophy, glaucoma, we have a very good result with them. Initial trial we done with 5 patients, all the results are so far successful. Then neurological segment, patient with a Parkinsonism, patient with a ischemic stroke, patient with a hypertensive stroke. We are treating all these patients and they all recover. Being an orthopedic surgeon, I put my patient through the treatment, like patients with the infections in the bone and the joint. I treated with the ozonated saline and the direct ozone injection. The results are very good. Not even the antibiotic can do this wonder. And other patients who need a surgery, like a tumor in the bone, I did a study on them. After amputation, instead of going for a chemo or radiotherapy, I put them on a ozone for 2-3 months. Still now 6 to 8 months now, there is no secondaries anywhere.
Starting before, I am daily drinker, really using alcohol. And come here now, after no alcohol, no smoking, no full diet controlled.
The second part of our treatment based on the patient with the HIV positive nature, we call it as a AIDS. India, AIDS is very rampant now. And we live in Coimbatore. Nearby our state is the Namakkal area, which is the second highest in India. So we picked up this particular Coimbatore and started the hospital here. The incidence is so high, like every day 40 to 50 patients die of AIDS here in Coimbatore. So we took that patients and started experimenting on them. We around treated 40 patients here. The results are very high.
Definitely. Ozone is my life, my blood, my bone, my skin, my hair. 100% I am ozonized man.
When he came, the first test we did, the viral load was 100,000. So after that, when CD4 counts were around 200, he knows better. So 200. And then we started on all these procedures.
I could instantly feel the difference. Instantly, right after. And after 2 days, I had a shoot. I was on shoot. And by 6, 7, as I said, by 6, 7 o'clock, I'll be lethargic. But I'm telling you, I'm happy. I'm overwhelmed. I'm excited that I wasn't feeling lethargic. I was climbing upstairs 6, 7 in the evening, and during that time, I'm really tired. I'm sloshed.
I'm going to show you what happens during typical RHP to the heart. We have a special patient here. He's the father of Mr. Pushpa.
So after we bring him a few times, then you see how we're doing. We explain to him what is the effective of this therapy, and we did for 2-3 times, and he feel good. He feel very energetic.
Aha, energetic.
Yes, even though he still have this problem after treatment, but he feel he can walk faster than those days.
Okay, you can see what we're doing here. We're doing a heart scan on him, and what we're going to do is we're going to do a heart scan before, we're going to do it during, and we're going to do it after. And we're going to show what happens during RHP, EBU, whatever you want to call it. This is Ein. Ein's the echo specialist. Ein, say hello to everybody.
Hello.
Good. I'll come back after the next one, okay? All right, we're back. Now, you see this red liquid she's putting in there? It's not really red, it's kind of pinkish. That is, I believe, B12. Right, Vicky?
Yep.
Yep, okay, so we got B12. We're putting it in now. So you see whole various amounts and it goes straight into the bloodstream. That's the beauty of this place, okay?
Yeah, it burns out the fats and it's a master antioxidant.
There you go. Isn't that cool? Burns out fat. I'm sure we all need that, especially in the United States. And it's a powerful master antioxidant.
Thank you.